A fecal transplant may improve the symptoms of Parkinson's disease. Transplantation of fecal flora, i.e., the transfer of intestinal microorganisms from healthy people to the intestines of people suffering from Parkinson's disease, may alleviate the symptoms of the disease. Clinical trials have shown more work is needed, but the results suggest that this method offers a safe and effective way to improve the symptoms and quality of life of people with Parkinson's disease. Clinical trials conducted by scientists from Ghent University Hospital, Vlaams Instituut voor Biotechnologie, VIB, and Ghent University have shown great potential for transplanting fecal flora from healthy people into the intestines of patients suffering from Parkinson's disease. Fecal transplant has been shown to alleviate the symptoms of the disease and may soon become a new method of treating the disease. The description and results of the research were published in the journal, eClinical Medicine. Parkinson's disease is a slowly progressive disease of the central nervous system. Paralytic tremor, as it is also called, is caused by a deficiency of the neurotransmitter, dopamine. This is caused by the death of neurons that produce the neurotransmitter. Dopamine helps control and coordinate movements, which is why Parkinson's patients have such characteristic symptoms as tremor, stiffness and balance disorders. In Parkinson's sufferers, there is also a clear disturbance of body posture and gait. Patients move in small steps, the so-called shuffling gait. They also lose balance when walking with their upper limbs. These disorders often lead to falls. Non-motor symptoms, such as loss of smell, constipation and REM sleep disturbances, develop very early, up to 20 years before diagnosis. In this disease, a protein called alpha-synuclein misfolds and sticks together. Such protein lumps form in the intestinal walls at a very early stage of the disease. They reach the brain, where they damage cells that produce dopamine. Research conducted over recent years has shown a relationship between the disease and the intestinal microbiome, i.e., the billions of bacteria living in our intestines. Patients with Parkinson's disease often have an altered gut microbiome compared to healthy people. They also often show more inflammation and have a disturbed intestinal barrier. Parkinson's disease is the second most common neurodegenerative disease after Alzheimer's disease. According to estimates, over 8 million people suffer from it. Since it most often occurs in the elderly, this number is likely to increase as the world's population ages. Current treatments, mainly dopamine replacement drugs, often have side effects and lose effectiveness over time. Given the link between the disease and the gut microbiome, Belgian scientists wanted to test whether a fecal flora transplant containing healthy gut bacteria could have an impact on the progression of the disease. 46 people were recruited for the study. 22 of them received a fecal transplant through a tube inserted into the nose and into the small intestine to deliver a mixture of healthy gut bacteria directly there. The rest of the volunteers received a placebo. Patients were monitored for 1 year. After just 6 months, Scientists saw improvement among people who received a fecal transplant. After 1 year, this group showed significantly greater improvement in motor symptoms compared to the group that received a placebo. Our results are really encouraging, says Dr. Arnoud Bruggemann, co-author of the study. After 12 months, participants who received a stool transplant from a healthy donor showed significant improvement in motor scores. The most important measure of Parkinson's disease symptoms, he added. Scientists believe the improvement in symptoms may be related to changes in bowel movements, although further research is needed to confirm this. But improvement was also visible in non-motor symptoms. Study participants were less likely to experience constipation, which is a common and bothersome symptom of Parkinson's disease. This study represents a significant step forward in the search for new treatment options for Parkinson's disease. Our research provides promising indications that fecal flora transplantation may be a new, valuable method of treating Parkinson's disease, says Professor Roosmarijn van den Broeke. More research is needed, but this is a potentially safe, effective and cost-effective way to improve the symptoms and quality of life of millions of people with Parkinson's disease around the world, he adds. Researchers now intend to determine which specific species of bacteria have such a positive effect on patients. However, considering that billions of bacteria live in our intestines, identifying these microorganisms can be a difficult task. However, if this were successful, it could lead to the development of a bacterial pill or other targeted therapy that could replace fecal transplantation in the future.